Let's talk about teenage acne. Hi, I'm board-certified dermatologist Dr. Jenny Liu, and today let's discuss effective and accessible products for fighting acne. Thank you to Clean and Clear for sponsoring today's video. All the products that I'm going to discuss today are available at Walmart. Acne, it's affected all of us at some point in our life, right? And many of us, including myself, still struggle with acne even into our 20s and 30s and 40s. But just to give you guys an idea how prevalent it is, about 85% of individuals worldwide between the ages of 12 to 25 will experience acne. I mean, that's a lot of people, right? And as a board-certified dermatologist, this is by far one of the most common conditions I treat. We first start noticing acne during puberty, during adolescence, and it can be a very awkward time. Our body is already going through all these changes. We're starting to take more notice of our self-image, the way we look, and then bam, acne hits you. One of the main things that we see happening with our body is hormone stimulating increased oil production. And so acne starts obviously with clogged pores. On top of that, increase in sebum or oil production leads to more clogged pores. And we have all this bacteria on our skin that loves to digest and eat away at the oil, reducing inflammation. And so really at the start of acne, what we see in teenagers are clogged pores. So blackheads, whiteheads, and red pimples when it gets really severe. And this phenomenon even continues into our 20s and 30s. And it's not just the acne itself, but the hyperpigmentation as well as the scarring. Now, understandably, not everybody is able to see a dermatologist. And for those individuals who are not able to or who are just starting off with mild acne, today's video can be really helpful to offer you guys some tips, ingredients, and products that you can try, especially if you are just noticing acne or can't get into a dermatologist to treat your acne. But I want to just caveat this video by saying that if you do really have severe acne, like the deeper nodules and cysts, and or you're already noticing hyperpigmentation or scarring, please find a dermatologist, because the most effective treatment when you do have severe acne are going to be prescription medications. Now, before we dive into how to care for your skin and how to treat your acne, I just want to clarify a few common misconceptions or myths I hear all the time. Number one, acne is not about how clean or dirty your skin is. A lot of times, I have patients even coming and saying, oh, my skin is dirty. I didn't wash my face well enough and therefore I'm getting acne. That is 100% false. In fact, if you over clean your skin and significantly disrupt your skin barrier, that can actually cause flare-up of acne. Acne is complex. It's multifactorial, from clogged pores to sebum production to inflammation. So all that plays a role. The other myth I hear about is only oily skin individuals gets acne, and that is completely false as well. Dry skin individuals, sensitive skin, normal skin, combination skin, all types of skin will experience acne. I personally have more dry skin. I still experience hormonal acne. Number three, certain skincare products or makeup can cause acne. That is really not true. Makeup itself or certain skincare products usually don't cause acne, but what is happening is here, if you are acne prone and you don't remove your makeup or your heavy skincare products, that can maybe clog pores, or say the residual products can lead to inflammation and therefore may flare your acne. So what is a proper way of caring for your skin when you do have acne? In acne prone skin, there is a disbalance of bacteria on the skin, and two, there is actually a very subtle dysfunction of your skin barrier. And what I mean by that is, in general, because of the inflammation associated with acne, your skin is not able to stay healthy and hold on water as readily as skin that is normal and not affected by acne. Two, in general, acne treatments tend to be drying and irritating. So when you have acne and you're treating it, your skin is way more likely to get dry and irritated. And all this irritation and dryness means that there's going to be more inflammation and potentially flare up of your acne. So in addition to treating your acne with acne fighting ingredients, it's also really important to use gentle products that's going to help to repair your skin, keep it healthy or as minimally dry and irritated as possible. We don't want to just focus on using ingredients to target acne acne, but also want to focus on your skin health as a whole. So let's talk about how to treat acne. When I see a patient, how I treat the individual really depends on the type of acne they have. If you are just noticing mild acne or the start of acne, and or you don't have the time or the ability to see a dermatologist right now, definitely always try over-the-counter products first. And if you're not responding, then by all means, please see a dermatologist. So when it comes to using over-the-counter products for fighting acne, the two that I always talk about and recommend, and I consider them, as most dermatologists do, the dynamic duo, are benzoyl peroxide and a topical retinoid. And here, when I say topical retinoid, I'm only referring to adapalene, nothing else. Benzoyl peroxide is great because it has a long-standing history and being effective against acne. It helps to kill off acne-causing bacteria. It reduces inflammation and can help a little bit with blackheads and whiteheads. And one of the best things of benzoyl peroxide is that the way it works, bacteria cannot develop resistance to it. In fact, when I prescribe a topical or oral antibiotic, I always pair it with benzoyl peroxide because we know that these bacteria they get really smart and they can develop resistance very quickly if you just use a topical antibiotic alone without benzoyl peroxide. And so this is really where benzoyl peroxide can be used in long-term basis, and it is safe. You don't develop resistance to it. Now, Clean & Clear is a brand that is near and dear to my heart because it's the brand that I used as a teenager when I dealt with acne. Their 10% benzoyl peroxide has been around a long time and is a very effective spot treatment for acne. So this Persa Gel 10 contains 10% benzoyl peroxide in a cream formulation. And what I recommend how to use this is really apply on clean skin to spot treat individual zits or pimples. You can use this twice a day, but because it can be irritating, I recommend starting off once a day. Doesn't really matter when. Apply it to your skin, let it absorb, follow it with your moisturizer at night or your moisturizer and sunscreen in the morning. And then you can gradually increase the application to twice a day as tolerated. Now, benzoyl peroxide comes in various different formulations from 2.5 up to 10%. And one of the main downsides of benzoyl peroxide, unfortunately, is that it can be dry and irritating. And so this is where the higher concentrations can be more irritating. So this is where you may want to consider using a benzoyl peroxide cleanser over a leave-on treatment. And studies have shown that cleansers can have similar efficacy as leave-on products. The leave-on treatment especially, it can bleach towels, pillowcases, and t-shirts. So just be mindful of what you're wearing and what you're sleeping on when you are using a topical benzoyl peroxide leave-on treatment. The Persa Gel 10 can be used in combination with topical adapalene. Adapalene is a topical retinoid that is great for preventing as well as treating acne. And what adapalene does is it helps to unclog pores and really helps to prevent that comedone or the clogged pore, which is the start of acne. And so adapalene is also great because it's one of the least irritating topical retinoids that are available, and it's over the counter. And two, it's fairly stable and can be used with leave-on topical benzoyl peroxide. And so if you do choose to use topical adapalene, I recommend using that at night. Apply it to your face, a pea-sized amount all over your face, follow with your moisturizer. If your skin is fairly tolerant of benzoyl peroxide, then you can follow benzoyl peroxide afterwards to spot treat. Otherwise, I recommend spacing them apart, using benzoyl peroxide leave-on treatment in the morning and topical adapalene at night. So those are two of the most effective ingredients, great combination for treating mild acne. But often with those two treatments, we can't just stop there. We really need to come up with a skincare regimen as well, because otherwise your skin is going to get really dry and irritated, and you're not going to want to use these products because of that skin irritation. And two, that irritation is not going to help with your acne. So this is where using a gentle cleanser and a good moisturizer as your foundation skincare routine is number one, really going to help to minimize the irritation, but also allow you to better tolerate your products and become more consistent and compliant with your acne treatment. If you're looking for a gentle cleanser but still effective at removing makeup, sweat, oil and dirt at the end of the day, try the Clean and Clear Aloe Vera Acne Prone Gentle Cleanser. This is a gel foaming cleanser, but it's still fairly gentle. It contains less irritating soap or surfactants, along with aloe vera that's soothing and glycerin that's hydrating. Oil-free, so great for those who are acne prone or have oily skin, and rinses off fairly well without having any feeling of like residue left on your skin. And it's also suitable for sensitive skin. Now, when it comes to moisturizer and sunscreen, pick one that you like enough that you will want to wear on a daily basis. I find that for a lot of my teenage patients, because they are going through these, body changes and there's more oil production, going with a lighter lotion, oil-free formulation, or even like a gel cream formulation are better liked than going with a thicker moisturizer. But if you do have more dry and or sensitive skin, definitely consider using a richer, thicker moisturizer, especially at night, to really combat the irritation that you may experience from topical acne treatment. So a simple acne treating routine can consist of using this gentle cleanser once or twice a day, and the most important one is just to remove everything at night before you sleep. So in the morning, use a cleanser or just use water to splash your face, followed by a topical treatment either in the morning or at night, or both if you're able to tolerate that. And that would be using like the Persa Gel 10 to spot treat any active acne. And then at night, you would use your topical retinoid, your Adapalene, all over your face to help treat and prevent acne, followed by your moisturizer. So these are my thoughts on teenage acne, and often what I would recommend to my patients for treating acne with using over-the-counter products. Have you tried any of these? Comment below, let me know what has worked well for you. Again, I want to thank Clean and Clear for sponsoring this video, and all these products I mentioned today can be found at Walmart. You can follow me on Instagram as well as TikTok, and please give this video a thumbs up and subscribe to my YouTube channel. I'll talk to you guys next time.